Today, we begin with something unexpected and brutal. The neuroscience of opioids and fentanyl, but not as you imagine. Nothing about dramatic drug busts or sensationalized overdoses. This time, you'll be simply you, an ordinary person living among molecules that dance with your brain's receptors in ways both fascinating and terrifying. So before you settle in, like the video and subscribe if this truly resonates with you. Now, adjust your light, take a deep breath, and let's journey through the science together. You're lying there now, perhaps with your eyes already growing heavy, wondering about the mysterious power that makes something like fentanyl so dangerously alluring. The room around you is fading as your mind begins to drift toward understanding. Imagine, if you will, your brain as a vast cityscape at twilight, millions of lights flickering in patterns too complex to fully comprehend. Within this neural metropolis are special districts where particular messages are received and processed. These are your receptor neighborhoods, and tonight we'll be visiting one special area, the opioid receptor district, where molecules like fentanyl make their first gentle yet profound introduction. The warmth begins so subtly you hardly notice. That's how it always starts, with a molecular embrace so perfect it seems designed by some cosmic locksmith. As you breathe deeply and settle further into your comfortable position, imagine a key sliding into a lock with such precision that the mechanism yields completely. This is what happens when fentanyl molecules travel through your bloodstream and reach your brain. These tiny messengers, each one a fraction of the width of a human hair, drift through the blood-brain barrier with remarkable ease. Unlike many substances that struggle to enter the brain's heavily guarded domain, fentanyl passes through effortlessly, like a VIP guest whose name is already on the exclusive list. The opioid receptors in your brain, mainly the mu opioid receptors, have evolved over millions of years to respond to your body's natural endorphins, those chemicals released during exercise, laughter, or love. These receptors sit embedded in the cell membranes of your neurons, waiting patiently for the right molecular shape to arrive. When your natural endorphins dock with these receptors, they fit perfectly, like a hand slipping into a well-worn glove. But fentanyl fits differently. Not just well, but with an almost supernatural precision, binding to these receptors approximately 50 to 100 times more strongly than morphine. It's as if these receptors have been waiting their entire existence for this particular molecule, though of course they evolved long before fentanyl was ever synthesized in a laboratory in the late 1950s by Belgian chemist Paul Janssen. As you continue to relax, breathing slowly and evenly, imagine these microscopic interactions happening inside your brain right now, not with fentanyl, but with your own natural chemicals. The same basic mechanism that makes fentanyl so powerful is working gently and naturally within you as you begin to drift towards sleep. Your endorphins are embracing their receptors, bringing you toward that comfortable state between wakefulness and dreams. The second moment comes quickly after the first, like the spreading warmth of sunlight after the first ray breaks over the horizon. Once fentanyl binds to the mu opioid receptors, a cascade begins that would be beautiful to witness if we could shrink ourselves to the molecular level. Inside the neuron, signaling proteins called G proteins detach and begin their mission. It's like watching dominoes fall in perfect sequence, each one triggering the next in a choreography of molecular movement that has evolved over eons. You're sinking deeper into comfort now as we explore this cascade. The G proteins trigger the inhibition of an enzyme called adenylyl cyclase, which in turn decreases the production of a messenger called cyclic AMP. This creates a cascading effect throughout the cell, ultimately leading to a decrease in calcium influx and an increase in potassium efflux. The scientific terms may sound complex as they drift through your consciousness, but the effect is simple and profound. The neuron becomes less excitable, less likely to fire, less likely to transmit pain signals. But this is only part of the story. The true magic, or perhaps the true danger, lies in what happens next. As these neurons become quieter, other neurons that they normally inhibit become more active. These are the neurons in your brain's reward pathway, particularly in an area called the ventral tegmental area, which connects to the nucleus accumbens, the pleasure center of your brain. As these inhibitory neurons are themselves inhibited by the opioid effect, the result is a massive release of dopamine, flooding your system with a sensation of profound well-being. Imagine a dam that has been carefully regulating the flow of water suddenly opening its gates. The rush of dopamine through your neural pathways creates a sense of euphoria that far exceeds what your brain would naturally produce. If you were to experience this, time might seem to slow, anxieties would dissolve, and a profound sense of contentment would wash over you. Pain, both physical and emotional, would seem distant and unimportant. The world would be bathed in a gentle glow of rightness. As you continue to relax, notice how your own body naturally produces similar effects, albeit in much gentler ways. The comfort of your bed, the softness of your pillow, the rhythmic sound of your breathing, all of these sensory inputs trigger small, natural releases of your brain's own comfort chemicals. No artificial substances required, just the exquisite natural pharmacy that exists within you, working in perfect harmony with your environment as you drift further towards sleep. The third moment reveals itself more quietly, like a whisper that somehow drowns out a shout. It's the extraordinary potency of fentanyl compared to other opioids, a potency that makes it both medically valuable and frighteningly dangerous. As you sink deeper into relaxation, consider this remarkable substance, created initially not for misuse, but as a medical breakthrough for managing severe pain. When Paul Janssen synthesized fentanyl in his laboratory, he could hardly have imagined how this molecule would eventually transform pain management and later, tragically, alter the landscape of substance use disorders. The potency of fentanyl is difficult to truly comprehend. It is approximately 50 to 100 times more potent than morphine, meaning that a quantity of fentanyl smaller than a few grains of salt can have the same effect as a much larger amount of morphine or heroin. This extreme potency makes it invaluable in medical settings, particularly for patients experiencing breakthrough pain or undergoing surgical procedures. A tiny amount can provide profound relief. Imagine, as your body continues to relax muscle by muscle, a substance so powerful that a quantity equivalent to a few specks of dust could render a person unconscious. In medical settings, fentanyl is measured in micrograms rather than milligrams, a microgram being 1/1,000,000th of a gram. For comparison, a typical grain of sand might weigh about 50,000 micrograms, while a lethal dose of fentanyl might be as little as 2,000 micrograms for an opioid-naive person. This means that an amount of fentanyl that could fit on the tip of a pencil could potentially be fatal. This extraordinary potency creates challenges in properly dosing the drug, whether in medical or illicit contexts. In hospitals, fentanyl is carefully measured and administered by trained professionals using precise equipment. But outside of medical settings, it's virtually impossible to accurately dose without specialized equipment. This makes illicit fentanyl particularly dangerous. A difference of a fraction of a milligram can mean the difference between the desired effect and a potentially fatal overdose. As you breathe deeply and feel the weight of your body settling comfortably, consider how this potency relates to the brain mechanisms we discussed earlier. Because fentanyl binds so strongly to opioid receptors, it takes very little of the substance to activate a significant proportion of receptors throughout the brain and body. This high binding affinity is part of what makes fentanyl so effective at relieving pain and also what makes it so powerful at producing euphoria and respiratory depression. The whispered power of fentanyl lies in this paradox. Something so tiny, so seemingly insignificant in quantity, can produce such profound effects. It's a reminder of how delicate the balance of chemicals in our brains truly is, how small adjustments to our neurochemistry can create dramatic changes in our experience of consciousness. The fourth moment unfolds more slowly, like vines gradually, wrapping around a trellis, invisible at first, then suddenly unmistakable. This is the beginning of dependence, the subtle neural adaptations that occur even after a single exposure to fentanyl or similar opioids. As you drift closer to sleep, let's explore how these invisible bonds begin to form within the brain's intricate landscape. Your brain is remarkably adaptive, constantly adjusting to maintain balance. When powerful substances like fentanyl repeatedly flood your system, your brain begins to compensate. The first changes begin surprisingly quickly. Within hours of exposure, your brain recognizes that something external is activating your opioid receptors far beyond normal levels, and it begins to make adjustments to restore equilibrium. One of the first adaptations occurs at the receptor level itself. When repeatedly exposed to high levels of opioids, neurons begin to internalize some of their mu-opioid receptors, pulling them from the cell surface into the interior of the cell, where they can no longer be activated. It's as if the neuron is removing some of its locks so that the keys have fewer places to work. This process, called receptor downregulation, is one of the brain's first defensive maneuvers against overwhelming stimulation. Simultaneously, the neurons that have been repeatedly inhibited by opioids begin to adapt their signaling mechanisms. The enzyme adenylyl cyclase, which was initially inhibited by opioid receptor activation, begins to increase in abundance and activity, a phenomenon called superactivation. This is your brain attempting to push back against the inhibitory effects of the opioid, trying to restore normal signaling despite the presence of the drug. Imagine as you feel the comfortable heaviness of near sleep in your limbs, these microscopic changes occurring, not in your brain right now, but in the brains of those who have been exposed to opioids like fentanyl. With each exposure, these adaptations become more pronounced. The brain essentially retools itself to function in the presence of the drug, creating a new normal that requires the drug to maintain equilibrium. These adaptations explain why, with repeated use, opioids often become less effective at producing euphoria, a phenomenon known as tolerance. What once created an overwhelming sense of pleasure now barely keeps withdrawal symptoms at bay. The brain has adapted so thoroughly that it needs the drug not to feel good, but simply to feel normal. Without the drug, the super-activated adenylyl cyclase and other compensatory mechanisms create a rebound effect, the opposite of the drug's original actions. Instead of euphoria and pain relief, there is dysphoria and hypersensitivity to pain. As you drift further towards sleep, consider how these neuroadaptations illustrate something profound about our brains. They are not static organs, but dynamic, responsive systems constantly remodeling themselves in response to their environment. The same plasticity that allows us to learn new skills or recover from injuries can, under certain circumstances, lead to these persistent adaptations that underlie dependence. The invisible bonds of dependence form not because of weakness or moral failing, but because of the brain's fundamental nature, its constant drive to maintain homeostasis in the face of perturbation. This understanding has transformed how we conceptualize substance use disorders, moving from models based on choice and willpower to those recognizing the profound neurobiological adaptations that occur with repeated exposure to substances like fentanyl. And now, as your consciousness begins to fade into the comfortable darkness of approaching sleep, remember that these same mechanisms of neural adaptation allow for positive changes too. The formation of new memories, the strengthening of beneficial habits, the gradual healing of neural circuits after they've been altered. Your brain, even now as you rest, is subtly reshaping itself, consolidating the day's experiences, preparing for tomorrow's challenges. The same plasticity that can lead to dependence can also lead to recovery and growth. You're drifting deeper. Now, your consciousness floating somewhere between awareness and dreams. Let's continue our journey, turning now to what happens when fentanyl leaves the system, when the key is removed from the lock. This is where the whispered power we discussed earlier reveals its darker aspect. As your breathing slows and deepens, imagine what happens in a brain that has adapted to the presence of fentanyl when suddenly that presence is withdrawn. The process begins innocuously enough. As the concentration of fentanyl in the bloodstream decreases, fewer and fewer molecules are available to bind to opioid receptors. Those receptors that had been continuously activated now sit empty, waiting for a molecular partner that doesn't arrive. Remember those adaptations we discussed, the internalized receptors, the superactivated enzymes, the altered signaling pathways. They were sustainable, even invisible, when fentanyl was present, but without it they create a profound imbalance. The adenylyl cyclase enzyme, which had ramped up its activity to compensate for opioid inhibition, now operates unchecked, producing excessive amounts of cyclic AMP. Neurons that had dampened their activity to offset the drug's effects now fire with abnormal intensity. The delicate neurochemical balance that maintains our normal functioning is thrown into chaos. This chaos manifests as what we clinically term withdrawal syndrome. But that sterile phrase does little justice to the profound distress it causes. Imagine your body suddenly interpreting every normal sensation as an emergency. Your temperature regulation falters, causing alternating waves of chills and sweating. Your smooth muscles contract chaotically, creating cramping in your intestines and painful diarrhea. Your peripheral nervous system becomes hypersensitive, transforming ordinary tactile sensations into discomfort. What physicians sometimes call skin crawling. Your pupils dilate, your nose runs, your muscles ache with a deep, bone-penetrating pain. But perhaps most disturbing is what happens to your emotional state. The locus coeruleus, a small nucleus in your brainstem heavily populated with noradrenergic neurons, becomes hyperactive during opioid withdrawal. This triggers an extreme stress response, flooding your system with norepinephrine, a neurotransmitter involved in the fight or flight response. The result is profound anxiety, irritability, and a sense of impending doom that feels completely rational to the person experiencing it, though it has no specific object. As you continue to relax into near sleep, try to imagine this state not as something distant and clinical, but as a lived experience. Withdrawal is not merely uncomfortable, it is a total system malfunction that affects every aspect of a person's being. To the opioid-dependent brain, withdrawal is not simply unpleasant, it is interpreted as a threat to survival. This explains the overwhelming compulsion to obtain more of the substance, not primarily to experience pleasure, but to escape a state that the brain interprets as life-threatening. This desperate physiological state helps explain why, despite knowing the risks, despite sincere desires to stop, despite the potential legal, financial, and social consequences, a person dependent on fentanyl may continue to seek it. The drive to alleviate withdrawal becomes as powerful as the drive for food when starving or water when dehydrated. It becomes, in the most literal neurobiological sense, a matter of perceived survival. And yet, despite its intensity, withdrawal is temporary. The brain, with its remarkable plasticity, will gradually readjust to the absence of opioids if given enough time. The process is painful and difficult, but not endless. This knowledge forms the foundation of detoxification programs, which provide medical support during this period of readjustment. But detoxification alone is rarely sufficient for long-term recovery, because while the acute withdrawal syndrome resolves, other neuroadaptations persist for months or even years, creating vulnerabilities that require ongoing support to manage, as your mind continues its gentle drift towards sleep. Let's widen our perspective beyond the individual brain to consider how fentanyl moves through communities, an invisible tide that has reshaped the landscape of public health in recent years. The story of fentanyl's emergence as a public health crisis is one of unintended consequences, market forces, and the fundamental challenges of addressing pain in medicine. Fentanyl was never intended to become a substance of widespread misuse. For decades after its development in the late 1950s, it remained primarily within hospital settings, used for anesthesia and managing severe pain. In the 1990s, pharmaceutical companies developed new delivery systems for fentanyl, patches, lozenges, and sublingual sprays, designed to provide relief for patients with chronic pain, particularly those with cancer. These innovations were genuinely beneficial for many patients suffering from intractable pain. Around the same time, a broader shift was occurring in pain management. Pain began to be conceptualized as the fifth vital sign, alongside blood pressure, pulse, respiratory rate, and temperature. Medical professionals were encouraged to take pain seriously and treat it aggressively. Pharmaceutical companies marketed extended-release opioid formulations as having lower abuse potential, though this would later prove incorrect. The stage was set for a dramatic increase in opioid prescribing, as your body feels heavier and your thoughts more diffuse. Imagine the complex societal factors at work. The initial wave of the opioid crisis primarily involved prescription medications. As awareness of the risks grew and prescribing practices became more restrictive, many individuals who had developed dependence turned to illicit sources. Heroin, once considered a drug primarily used in urban areas, began to appear in suburban and rural communities across America. Then came the third wave of the crisis, the emergence of illicitly manufactured fentanyl. Unlike prescription medications diverted to illicit markets, this fentanyl was produced in clandestine laboratories, primarily overseas, and trafficked into the country. For drug traffickers, fentanyl offered significant advantages. It was cheaper to produce than heroin, required less space to transport due to its potency, and could be manufactured anywhere with the right precursor chemicals and equipment. No need for poppy fields, vulnerable to eradication efforts and dependent on suitable growing conditions. As you breathe deeply, feeling the weight of near sleep in your limbs, consider how fentanyl began to permeate the illicit drug supply. Initially, it was often sold as heroin or mixed with heroin without users' knowledge. Later, it began to appear in counterfeit pills made to resemble prescription opioids like oxycodone or hydrocodone. More recently, it has been found in non-opioid substances like cocaine and methamphetamine, sometimes due to cross-contamination, during packaging, other times as a deliberate addition. This infiltration of the drug supply created a situation where even people who never intended to use fentanyl were being exposed to it. Someone who believed they were using heroin might actually be using fentanyl, which is much more potent and can more easily lead to overdose, particularly in individuals without opioid tolerance. The margin of error became vanishingly small. The statistics tell a grim story. In the United States, drug overdose deaths involving synthetic opioids, primarily fentanyl, increased exponentially over the past decade. What had once been a relatively uncommon cause of mortality became one of the leading causes of death for Americans under 50. The COVID-19 pandemic only exacerbated these trends with isolation, economic stress, disrupted treatment services, and changes in drug supply chains, all contributing to increased overdose rates. Yet statistics cannot capture the full reality of this crisis. Each number represents a person, someone's child, parent, sibling, or friend. Communities have been devastated, particularly those already struggling with economic challenges, limited healthcare access, and few resources for addressing substance use disorders. The invisible epidemic became all too visible in emergency rooms, funeral homes, and family photo albums, with empty spaces where loved ones should be. As you hover in that liminal space between consciousness and dreams, let's consider the human dimension of this crisis, the stories behind the statistics. Beyond the brain mechanisms and public health data lies the lived experience of individuals, families, and communities affected by fentanyl and other opioids. These stories reveal the complex interplay of biology, psychology, and social factors that shape substance use disorders. Consider, as your thoughts grow more diffuse and dreamlike, the various pathways that lead to fentanyl use. For some, it begins with a legitimate prescription for pain, perhaps after surgery, an injury, or for chronic pain management. These individuals never intended to develop a substance use disorder. They were simply seeking relief from physical suffering. As tolerance develops and prescribing becomes more restricted, some may turn to illicit sources. For others, the pathway involves experimentation with substances, often beginning in adolescence or young adulthood. This experimentation intersects with risk factors like genetic predisposition, early life trauma, mental health conditions, or environmental stresses. What begins as occasional use can escalate as the brain's reward systems are repeatedly activated and neuroadaptations occur. Still others may use opioids as a form of self-medication for psychological distress, depression, anxiety, post-traumatic, stress, or the diffuse pain of alienation and disconnection. In a society where mental health care is often difficult to access and stigmatized, substances can become a maladaptive coping mechanism, offering temporary relief but ultimately exacerbating the underlying conditions. As your consciousness continues its gentle drift towards sleep, imagine the ripple effects of opioid use disorders throughout a person's life. Relationships strained or broken as obtaining and using the substance takes precedence over other activities and responsibilities. Employment becomes difficult to maintain due to impaired functioning or absenteeism. Financial resources are drained by the high cost of maintaining a supply, particularly as tolerance increases. Legal consequences may accumulate, creating barriers to housing, employment, and education. Family members experience their own profound suffering, watching a loved one transform, feeling helpless to intervene, exhausted by cycles of hope and disappointment, navigating the complex territory between supporting the person and enabling harmful behaviors. Children of parents with substance use disorders often experience disrupted attachment, unpredictable home environments, and sometimes trauma or neglect, increasing their own vulnerability to mental health and substance use problems later in life. Communities, too, bear collective burdens. Emergency services strained by overdose responses, child welfare systems overwhelmed with cases related to parental substance use, economic impacts of lost productivity and increased healthcare costs, and the intangible loss of human potential that could have contributed to community flourishing. Yet, amidst these devastating impacts, there are also stories of resilience and recovery. Individuals who, with appropriate support, are able to heal from opioid use disorders and rebuild their lives. Families who find their way to compassionate understanding of addiction as a health condition rather than a moral failing. Communities that come together to implement harm reduction strategies, expand treatment access, and address the underlying conditions that contribute to substance use. These stories of recovery remind us that substance use disorders, while chronic, conditions that often involve relapse, are treatable. Evidence-based approaches like medications for opioid use disorder, methadone, buprenorphine, and naltrexone, psychosocial interventions, peer support, and addressing co-occurring mental health conditions can be effective. Recovery is not simply the absence of substance use, but the development of a fulfilling life with meaningful relationships, purpose, and well-being. As you drift closer to sleep, your thoughts becoming more fragmentary and dreamlike, let's explore a final dimension of this complex issue, the paradox at the heart of opioid medications like fentanyl. These substances represent both remarkable medical achievements and sources of tremendous suffering, saving lives in some contexts while endangering them in others. In medical settings, fentanyl remains an invaluable tool. During surgery, it provides powerful pain relief and sedation without the cardiovascular depression that other anesthetics might cause. For patients with severe acute pain or breakthrough pain in cancer, it offers rapid, effective relief. In palliative care, it helps ensure that people can spend their final days in comfort rather than agony. These are not small mercies, but profound contributions to human welfare. The development of synthetic opioids like fentanyl represented a significant advance in pain management, creating options that could be precisely dosed, modified to change their duration of action or route of administration, and produced consistently without relying on poppy cultivation. Paul Janssen's synthesis of fentanyl in 1960 was not an act of malice, but an attempt to improve human health, to address the fundamental human problem of pain. And herein lies the paradox. The same pharmacological properties that make fentanyl valuable in medicine make it dangerous outside of carefully controlled medical settings. The high potency that allows for effective pain relief with minimal volume also means that slight dosing errors can be fatal. The rapid onset that makes it useful for breakthrough pain also creates intense euphoria when misused. The ability to cross the blood-brain barrier efficiently, which enables it to work quickly, also contributes to its high potential for dependence. As you feel yourself slipping further towards sleep, consider how this paradox extends beyond fentanyl to our broader relationship with pain and suffering. Pain serves an essential biological function, warning us of damage or disease and promoting protective behaviors. Yet persistent or severe pain can become maladaptive, reducing quality of life and functioning. Finding the balance between managing pain effectively and avoiding the harms of pain medications remains one of medicine's most challenging dilemmas. This paradox also manifests in our societal approaches to substance use disorders. We recognize the need for compassionate, evidence-based treatment while also acknowledging the very real harms that substance use can cause to individuals and communities. We struggle to integrate harm reduction approaches, which aim to minimize negative consequences of use with prevention efforts and treatment that targets abstinence. We want simple solutions to complex problems that involve biology, psychology, economics, policy, and culture. The story of fentanyl, from medical breakthrough to public health crisis, illustrates how our attempts to solve human problems can sometimes create new ones. The efforts to address pain led to increased opioid prescribing, which contributed to rising rates of opioid use disorder. Efforts to restrict prescription opioids without adequately expanding treatment led some to turn to illicit markets, where fentanyl eventually proliferated. Attempts to control fentanyl trafficking pushed toward even more potent analogues like carfentanil. Yet this story need not be one of inevitability or despair. Understanding the neurobiology of opioids helps us develop better treatments for both pain and substance use disorders. Recognizing the complex social determinants of addiction can guide more effective prevention efforts. Acknowledging the limitations of purely punitive approaches opens space for public health-oriented strategies that reduce harm and save lives. As your consciousness begins to fade completely into sleep, consider how this exploration of fentanyl, from molecular mechanisms to social consequences, reflects broader themes about human vulnerability and resilience. Our capacity for pleasure and pain, our brain's remarkable adaptability, our need for connection and meaning, our attempts to alleviate suffering, sometimes creating new forms of it. These are not unique to opioids, but fundamental aspects of the human condition. And now, as you drift into the realm of dreams, perhaps your unconscious mind will continue to process these complex ideas, integrating them into your understanding of the world. The warmth of your bed, the weight of your blanket, the rhythm of your breathing, these simple comforts remind us that we need not seek artificial euphoria to experience well-being. Your body knows how to heal itself, your brain knows how to find balance, and even in sleep, you continue the essential work of maintaining that delicate equilibrium. So I think you must be dreaming about all of this by now. So I'll just leave the fireplace lit for you to feel comfortable and warm. Bye.
Bye.